Guys, it's Dr. Balt here at Long Neck Chiropractic. Thanks again for checking out our website, drbalt.com, where you're watching our weekly video. If you take a look at the newsletter this month, we put an article on addictions and chiropractic care. You know, in Sussex County, someone dies of an overdose every other day. Presently, there are thousands of patients who suffer from addictions, and right now the statistics would say that 80% of those who are using heroin have started that path by taking some sort of pain medication. So chiropractic has been around since 1895, and we've always offered a non-medication treatment of your pain and pain syndromes. So what I'm suggesting to everybody today is that pain is a mechanism by which the body tells you that there's an inherent problem. A problem with a joint, a problem with a muscle, a disc, or one of the spinal nerves, or one of the peripheral nerves in the body. And the pain is only a symptom. And so, as the symptom is very similar to a warning light that might come on in your car, the check engine light, the check oil light, the light itself, as the pain, is not the problem. So as a result, you never want to cover up the light, and you never want to cover up the pain. What you want to do is you want to get the cause looked into. In our office, most pain that we see comes in the form of spinal misalignments. They're called subluxations or chiropractic subluxation. When the spine is not in proper position, the vertebrae are unable to move properly, and we would call that hypomobility. Not only is there a lack of proper movement, but the discs themselves can be deformed, and they can begin to put pressure on the nerves, and you might get a pain that travels down an arm to your finger, a numbness. You might get a pain that travels from the small of your back down into your leg. Some people might refer to that as sciatic type pain. So rather than giving you pain medication, which now we know that 80% of people who are addicted to heroin today started with pain medication, rather than encouraging you to take anti-inflammatories, which by the way, each tablet you take causes your stomach to bleed 1 tablespoon of blood. Rather than taking muscle relaxers that relax all the muscles in your body, skeletal, cardiac, and even your stomach and intestinal tract, rather than doing that, our purpose is to examine your spine, see where the misalignments or where the mobility of the spine is not in proper position, and through a specific chiropractic correction, restore the spine back into normal alignment and movement, freeing up the tension on the nerves and restoring tone back to the body. If we can do that, we can get you through the crisis part of your care. And that usually is accomplished within a couple easy adjustments. Then people actually want to get into many people want to get into the corrective type of care where muscles, nerves, ligaments, tendons can reestablish their normal position. And some patients actually choose in our office to do in some sort of continual care. Because once your body is functioning at its optimal level, there's no point in allowing it to slip back. I encourage you to read every part of our website this month, some really good information. I encourage you to come into the office and ask the questions that you have. What we're telling you, you're not going to hear in your medical doctor's office. You're certainly not going to see it on TV. But I know what we do for you is going to have longer lasting effects for your health in the future. I look forward to seeing you in the office shortly.